Hi everyone, myself Abarna Suresh. I am MSW second year of Sri Shabrisha College, Kerala. Today we are to discuss the topic treatment and prevention of major communicable and non-communicable disease. Communicable disease. First of all, we are discuss the communicable disease. Communicable disease are a illness that spread from the one person to another person. Infection against such as a virus, bacteria, fungi and parasites. These infections can be treatment through direct contact, contaminated food and waters, air droplets and infected the bites. They remain a major public health concern, especially in developed countries where factors like poor sanitation, overcrowding, and lack of awareness contribute to their spread. The example of communicable disease including TB, HIV, malaria, dengue, hepatitis, COVID 19, cholera, typhoid, etc. TB. Tuberculosis is the caused by Mycobacterium tuberculosis and to primarily affect the lungs. It treated with a combination of anti-TB drugs such as a rifampicin, isoniazid, ethambutol, and to paracetamide under the directly observed treatment short course. The programs ensuring to complete recovery and prevent drug resistance. Next disease is HIV. HIV is a weakness of the immunity system by attacking CD4 cells. The main treatment is a antiretroviral therapy which help to reducing the viral load, improving immunity and enable to patient to live longer and healthier lives. Next one is malaria. Malaria is a caused by Plasmodium parasite. Treatment throughout the beat of infection mosquitoes. Treatment including anti-malarial drugs such as a chloroquine and to artemisinin based to combination therapy. Early diagnosis to treatment are essential to prevent a complications. Next one is dengue, a viral disease treatment by Aedes mosquitoes. Sign there is not a specific antiviral treatment. Management focused on symptomatic care, maintaining to hydration, reducing to fever, and monitoring to platelets, con, con, platelet counts to prevent a several complications. Next one is hepatitis. Hepatitis B and C. These are viral infection. This affected to liver. Treatment involved antiviral medication and supportive care to protect the liver functions and prevent a long-term complications such as a cirrhosis and liver cancers. The next disease is cholera and typhoid. Both are the waterborne bacterial disease caused by to contaminated food or water. Treatment includes in antibiotics, oral hydration solution, and to intervention fluid to replace the loss of electrolyte and preventive dehydration. The COVID-19 infection, these viral respiratory infection are to treated with antiviral drugs, symptoms management and supportive care. In severe cases, hospitalization may be needed for oxygen support and monitoring. The preventive measures play to viral control to controlling to the spread of communicable disease, immunication, personal hygiene, safe sexual pa- practices. First of all, preventive immunicable immunication. Immunization is a vaccination is the most effective way of the preventive many infection disease. Immunization is a programs target the disease such as a hepatitis B, polio, and COVID-19, helping to the building community immunity and reducing outbreaks. The personal hygiene regularly hand wash with soap, maintaining clean surrounding and consuming safe food and water prevent the spread of many infections like a cholera and typhoid. Vector controlling to the mosquitoes and other viruses help to reducing disease like a malaria and dengue. This can be done by using two mosquito nets eliminated to the stagnant water with the mosquitoes breed. Safe sexual practice. The next point, using to condom and undergoing to regular medical checkup preventive to transmission of sexually transmitted to infections such as HIV and hepatitis B. Isolation and early detection. Identify to the isolation and infected individuals early throughout the screening and quarantine help to break the chain and transmission and co- uh, contain outbreaks. Health education, creating to awareness among the public about the disease spread, the importance of the vaccination and need to maintaining to hygiene, encouraging to healthier behaviors and community participation is the disease of prevention. We are next focused on non-communicable disease. The non-communicable diseases are medical conditions that are treated from person to person. They generally developed over long period and care caused by two combination of factors such as unhealthy lifestyle habits, genetic predisposition, environment infections, and physiological condition. These diseases have become a major public health concern worldwide, according for the large proportion to deaths and disabilities, particularly in developing countries. The examples of non-communicable disease: diabetes, hypertension, cardiovascular disease, cancer, chronic respiratory such as asthma and COPD, mental health disease and obesity. These conditions are too often too like risk factors such as a poor diet, physical inactivity, tobacco and alcohol use and stress. The treatment: diabetes is a metabolic disorders characterized by high blood sugar levels due to insufficient insulin production or ineffective insulin use. Treatment involves insulin therapy or oral hypoglycemic drugs along with the regular blood sugar monitoring, a balance of diet and regular physical activities and maintaining glucose control. Next one is hypertension or high blood pressure. Hypertension occurs when the force of blood against artery well to is to continually used to high. It is a managing throughout anti-hypertensive medication and self-reducing weight management and stress reducing techniques such as yoga, medication, and another activities. Next one is cardiovascular disease (CVDs). These including conditions like a heart attacks, stroke, and coronary artery disease. Treatment involves a lifestyle modification, cholesterol lower drugs, uh, be- beat blockers, anti-plastic therapy, anti-platelet therapies, and severing causes. Surgical interventions such as a angioplasty, bypass surgery. Next one is cancer. Cancer involves the uncontrolled growth of abnormal cells in the body. The treatment depended on the types of stages of the cancer and may including surgery, chemotherapy, radiation therapy or immunotherapy. Early diagnosis significantly improving treatment outcomes. Next one is chronic respiratory disease, asthma and COPD. These conditions affected of airway and lungs causes breathing difficulty. Treatment including the use of inhalers, bronchodilators, and avoiding to drugs like a smoke, dust, and pollution. Next one is mental health disorders. Mental illness such as a depression, anxiety, and bipolar disorders are treated through psychotherapy, counseling, and psychiatric medication and social support, promoting to mental well-being and to reducing stigma and essential for effective management. Next one is obesity. Obesity is a regular resulting for excessive body factors accum- accumulation of the major risk factors for other NCDs like diabetes and heart disease. Treatment including to dietary change, regularly exercise, behavior therapy, and in some cases medical or surgical interventions. The prevention of NCDs focused on a reducing modifiable risk factors and promoting a lifestyles maintaining to balancing diet, engaging to regular physical activities, and getting advocate risk help to maintaining to overall health and preventing NCDs. Avoiding to tobacco and alcohol, eliminating or minimizing to the use of tobacco and alcohol significantly reducing the risk of cancer, cardiovascular disease, and liver disorders. Regularly screening early dietitian throughout the continuous health checkup such as a blood pressure, blood sugar, and cholesterol. The cancer screening help to timely treatment and management. Stress management. Chronic stress contributed to the hypertension, depression, and other health issues. Techniques such as a yoga, medication, mindfulness, and counseling can improving to mental and physical well-being. Next one is health education, raising to awareness about the risk factors, symptoms, and uh, prevention of strategies for NCDs, encouraging to individuals the adopted to healthier habits and seek timely medication care. Environment control, reducing air and water pollution, ensuring to clean living space and promoting to green environment planning to importance of role of preventing respiratory and other chronic conditions. Thank you for watching.